All right, so the patient has all right-sided complaints. Okay, so I was going to do the concussion protocol there just to see if that was where her issues were, but I kind of found something interesting. So she has all right-sided complaints, so we're expecting to have a hypertonicity on the right. Hold your arm in, don't let me pull, hold tight. Good, nice and strong. And then if I pinch it, it should weaken, but because the issues are on the right, it shouldn't because of her. Hold tight, don't let me press. But it does weaken, okay? So we're thinking, okay, so maybe it is okay, but why is she having all right-sided complaints? But when we check on the left side, press in, hold tight. Good, drop this down. With autogenic inhibition, bring this up, hold tight. That doesn't weaken, okay? So that kind of has a discrepancy in what you would normally find, but we got to do IRT and all that sort of stuff first. So I found on her, if I rub over the neck here on this side, that actually corrects autogenic inhibition. Hold tight. So that makes that work properly. So let's fix that and see if all of these findings jump to the side where they should be. So I'm just going to do a little technique here to improve the proprioception and mechanoreception of the joints and tissues in this area. It's a little neurology trick. Good, and then I'm going to tap on some acupuncture points. That may help get that to work a little bit better. We'll see if this neurologic pattern changes. It's just a theory, but it'd be cool if it did. And that's why you gotta do one thing at a time. You gotta check, because if I just went through and adjusted her whole right side, it would just make it worse. So we gotta make sure her brain is kind of aligned and everything's working properly. All right, so we'll see if that made the difference in bringing the hemisphericity to the side where she has her complaints on. So we'll just jump back to the side that's not working properly. I'm going to see if autogenic inhibition now makes this work properly. Okay, so hold tight. All right, so she's not worse. Hold tight. All right, now it does work properly. Okay, cool. All right, so that fixed that. So let's see if it jumped to where it should be now. So again, let's just start in the clear. Hold tight here first, hold. Cool. Okay, let's see if this now does not respond. All right, hold tight. See, now it doesn't respond to autogenic inhibition, so we know we flip-flopped your brain. So now it's on the right side, which it should be. Okay, so now let's just try to figure out why that's occurring. All right, hold your arm in. Okay, it's not cochlear nerve. Swallow for me. All right, hold tight, don't let me pull. It's not vagus nerve. Move your head around for me. All right, good, relax. All right, hold tight. Okay, it's the vestibular apparatus and the cerebellum. Okay, so that's what we gotta. So we're gonna do that same protocol that you've seen before, and we're gonna fix this right side. Okay. All right, so we just finished with the adjustment here to correct the hemisphericity to see if we can take away the hypertonicity on this right side. So we did that through cerebellum activation. So again, we're just going to check here just in the clear first. Hold your arm in, don't let me pull. Cool, didn't make it worse. Now we'll see if she actually responds to autogenic inhibition. So we're just going to squeeze that muscle. All right, hold tight again, don't let me pull. Yeah, and she does respond now, so we know we balanced her brain properly. Okay, so she's going to feel a lot better. So sometimes you'll find that even though she has all right-sided complaints, the hemisphericity initially presented on the left side, but that was due to an injury in her neck, which we corrected. And once we corrected that, the pattern showed on the right side where it should be associated with her complaints. So we went through and corrected the left-sided hemisphericity through the right-side cerebellum stimulation. I'm going to give her right-sided cerebellar exercises to stabilize that. She should be feeling a lot better.